there doesn't seem to be a ton of prevention. It seems to be that you have the cardiac event, you have the heart attack, you end up in the ER, and then the journey begins on how to heal.
It's up to the patient, sad to say, because that's not the standard of care. We would love to, and some of the times doctors have their hands sealed. There's not much they could reach.
All right, guys, we're here today with Dr. Hoa. He's from the East Side, and we just have an info-packed episode to bring to you today, all around cardiovascular disease. We're going to talk about the cause, the treatment, the prevention. So if you or someone you know has heart disease in their family lineage or struggling with that today, listen up. What I do want to dive in today, Dr. Hoa, is your story and how you became someone who was interested in talking and treating heart disease, how you became interested in root cause medicine, not just going the conventional route, and who you are. So please, by all means, thank you for being here and just give us a brief introduction.
Thank you very much. I went to medical school, because I wanted to save life. That's the purpose. So I graduated, and my mother had cancer and she passed away. My father had cancer and he passed away. I did everything that the established medical practice guidelines, suggest. Nevertheless, my mother died, not in a nice way. When people used to tell me, try this, try herbal medicine, try ozone, try chelation, try this, I said, no, forget about that. No, I'm not in that. I mean, I'm in medicine. And then I saw that we don't cure nobody. Medicine by itself do not cure anything. If you have a tumor, we cut it out. That was a surgery, right? You don't have it no more, but that could come back again. So that means that you wasn't cured. So I start thinking into other ways to support what we have in medicine. And that's how I came through the American College of Advanced Medicine in chelation. And I went as a continuing education. I'm an educator, academic educator in health and science, college professor. And I was doing continuing education, and I was in a cardiology continuing education for acute coronary syndrome, for heart attacks, myocardial infarct. And next to it, there was another conference for this type of, which people call it natural medicine or homeopathic or integrated. It's actually biochemical. You need to know a lot of biochemistry in order for you to do that. So when I went there, everybody was like 80 years old, 76, 74, 60 something. I said, wow, that was a couple of years ago. And then I asked one of them, and their title, he said he was a neurosurgeon. There was another cardiology with him. There was another surgeon there, cardiothoracic surgeon. And they told me, I said, what are you doing here? You're retired. He said, yes, I want to cure. I want to cure myself and my people, my family. And then I said, but didn't you do that in medicine? He said, no. He said, you are a young doctor, so you will learn within the future. So that's practically what got me into this. And then I saw results that I cannot explain.
So interesting how your journey just led you there, right? It's like certain doors opened and certain doors closed, and there was enough index of suspicion of why you couldn't heal your parents from someone who is in medicine and gone through a ton of training. It's not an easy school to get to where you are at the level that you are. And just to have that index of suspicion of there's got to be something else, there's got to be something more, attend a conference and then have right next door this wealth of knowledge in, like you use many different names, holistic, functional, alternative medicine, just to say, hey, check this out, right? Become wise to the ways of the human body healing itself.
Yes.
It's a beautiful story. And I'm so thankful to have you on here today, and just thankful to glean some of your wisdom as well on this podcast. And so what we really want to get into is that cardiovascular disease, and just talk about acute coronary syndrome, what that looks like for someone listening right now. I was reading up on this a little bit and just focusing in on the actual event of a heart attack. And so I know that can't just be what we focus on today. Again, we want to talk about prevention, what you can do, but I want to just read these aloud because it was really interesting to me. Someone struggling with this event, they're having central constricting heart or chest pain, their feelings of pending doom, nausea, vomiting, sweaty, clammy, shortness of breath, palpitations, pain radiating to their arms. And that's kind of the trigger for this could be an actual cardiovascular event. Is that correct?
Yes, those are the clinical signs and symptoms that you could see. But there are patients that do not show any signs, or they don't show the signs continuously, as we could see. Sometimes we call that unstable angina, in which you just have like a sharp pain, and it goes through seconds, and that's it.
Interesting.
So yes. So first, let me just say that my thesis from my medical school was on pre-analytical errors, meaning the errors that occurs before things are analyzed, like in blood. Do you know that in America we have between 66 to 88% of blood test result wrong?
No, I didn't
So
know that.
PLSI, clinical and laboratory standard institute, anybody could just go into there, meaning that when the doctor received the blood test result, already comes with errors. Between 60 to 88% already has errors. So that means that if I don't get the right result or the more close to reality, my management will not be good. So when we're talking about acute coronary syndrome, 20 to 50% of all mistake not being able to identify this acute coronary syndrome happens because when we read the electrocardiogram, we miss it. So just reading an electrocardiogram right now, 20 to 50% of all malpractice comes from misreading EKG that we couldn't identify or diagnose acute coronary syndrome.
Does a patient present with these symptoms ideally, and that's the first time they know about it, or can you use different testing to predict they're entering into acute coronary syndrome? So let me rephrase that and just say, when you talk about the EKG, does that happen after they present with some sort of symptom, or is that something that's predictive in measure?
As a guideline, cardiologists, internal medicines, emergency physicians, any doctor, when the patient comes in, he have to do an electrocardiogram. It's part of a protocol, let's say.
Okay.
But once we do that, if you are not really well trained and you just follow what the machine is telling you, you are in big problem. So you need to do your calculation. You need to do your clinical impression. So in that point, cardiologists, 20 to 50% of the misread come from EKG, not identifying the acute coronary syndrome.
So this is all leading up to someone actually having a heart attack. It doesn't even need to get to that episode. It can be a listener goes to the cardiologist and they perform an EKG and they say, hey, we need to address this. This is what your EKG is showing me. If I'm reading it correctly and I'm reading the signs. And then we don't even need to get to the actual event of a heart attack.
Yes. It will all depend on the practitioner, his academic, his education, his continuing education, his experience, he or she, to actually see a little further than what we normally see in a medicine. I know you have heard from people, perhaps yourself, I hope not. My blood tests all came good, but I feel terrible. I'm not, I don't know. I go to the doctor and he said that everything is fine. That is in my mind. Please. That happens to a lot of people. And that is why it's a unidimension view. Medicine is not that.
I love that because you often hear someone going to the doctor and talking about their journey and the doctor saying, you're fine. It's in your head. Instead of listening to that patient's intuition and really honing in on, like, they know their body, they know their biology best. Let's trust and find the root cause, find what's ailing this individual. And you're saying just that, right? We're going to a little deeper.
Yes. And also, you know who's the only one that knows everything besides God? If you believe in God, if you don't, okay, but I'm a scientist and I'm a believer. Now, you know who knows everything in medicine? Pathologists. The
Hmm.
problem is that they know just, or they just let you know 1 or 2 days later after you die.
Interesting.
So,
Interesting. Now, I do want to get to prevention, but you had mentioned that not everyone presents with those symptoms I read off. And
yes.
through just researching this a little bit, I do hear it's different in women and even more different in your diabetic patient population.
Oh,
And so, are those people that need to be extra honed in on potential symptoms or potential proactivity around heart disease and prevention?
okay, let's talk about one simple concept in medicine, and perhaps your audience will know: cellular respiration.
Cellular restoration.
Exactly. What is that? Let's say the producing of energy and oxygen. If you close your mouth, if you close your nose for X amount of time, you will die because you need oxygen. Oxygen is a hydrogen acceptor. Let me not go into chemistry, but oxygen, you need it for life, the same as nutrition, food. So when you don't eat, when you are not eating properly, when you are not getting the amount of oxygen or that gas that you need, okay, you are going to die. You need both. You just need both, right? So when you have a blood vessel that is constricted, that is closed because you have plaque or fatty tissue around, you have less blood. If you have less blood, you have less oxygen. If you have less blood and less oxygen, your tissue will suffer from ischemia. And if we don't fix that by hyperfusing, then we're gonna have you're gonna have necrosis. The patient will die. So there are many things preventive that we could do, but it is, sorry to say, this industry with insurance, medical insurance, they will not cover preventive things. Like there is something that we call chelation. Chelation, we did for all your audience, if you go into American Heart Association in Google and you look for TAC trial, TACT, trial to assess chelation therapy. It was guided by Dr. Gervasio Lamas from Columbia University, and also Mount Sinai Hospital. They did a study because, once again, doctors normally, like me, uh, conventional doctor will say, that doesn't work, but you don't have evidence to say that. So the National Institute of Health gave like $30 million to Dr. Gervasio Lamas to do an independent study in which it's called a blind study, in which not even him know what is given to the patient. So, for example, we have it was like almost 2,000 patients. To 50% of the patient, they give chelation, and to 50% of the other patient, they give just placebo, just water and salt, sodium saline solution. He didn't know what he was putting into the patient, so he didn't know what the results. And when the results came, that he wasn't the one that evaluated, he saw that already patients that had a heart attack 50 years older of age, and that very patient had a 48% of not getting another heart attack within 5 years. In another word, it was proven that chelation worked by clearing up these blood vessels, removing those plaque formation, those minerals calcification, by doing that. And then therefore, without we going into the heart or into the chest or putting something into the artery, an invasive procedure, this blood vessel open up, reperfuse with blood and oxygen, and the patient good.
So that's the point of chelation therapy, is to go in, open up the vessels and remove the plaque, allow the blood flow to get to the heart.
Yes, just think about this. A magnet, what we put on the refrigerator, it attaches to metals, right? So there is a substance known as EDTA, ethylene diamine tetraacetic acid. It's a chemical compound that will attach to those metals or minerals and will plug it out, kidney filter, and throw it out through the urine.
Throw it
without
out the urine.
So it will help a small circulation, a small blood vessels, big blood vessels. It will help in blood circulation in total.
So now let me back up. We talked around kind of chelation therapy and going to a cardiologist. Who should seek out a cardiologist? Who should seek out this therapy right now? If they're walking around, they're like, I don't have a heart condition, or I don't know, right? I haven't had my blood drawn. I don't feel that I am in the category of someone who will have a heart condition. Who should seek out these therapies, and just a straight cardiologist? And maybe what questions should they ask?
It is kind of difficult to answer that question because not every doctor follow the outside standard of care studies. For example, lead, mercury, arsenic, cadmium, they are metals, sometimes they call heavy metals, that somehow or another are linked to all this plaque formation, obstructing and predisposing to a high risk heart attacks. So if you're not looking for it, you're not going to find it. But it's not that you're going to find it that easy, because in blood, you're not going to find that. That's into a urine and chelation therapy. For example, you come today, I give you a urine bottle container so that you could collect your urine for 24 hours, right? You bring it to me the following day. I will send that to a specific laboratory. They will do a specific toxic in whatever they are found there. Once I get the result, then I bring you back, and then I do a chelation on you. What does chelation do? It will pull out from your whole intracellular and all your body, all the minerals, all the metals and toxins that he could grab at that time. Then we collect again the urine, and then we send it to the lab. Once the lab process that, it sends it to you, then you could compare. And now you know what is happening to your body, because you're not going to find that in blood. Very difficult you find that in blood.
So to trigger someone listening, how to or when to seek this type of therapy, I know, let's say we get a prostate exam at a certain age. Is there an age range where this is recommended? Someone needs to just dive in a little deeper to say, hey, I reached this age, heart disease runs in my family. Maybe I know I have a heavy metal toxic load to my system for some reason or another. Maybe I struggle with different chronic syndromes that could lead to this. Is there a trigger age-wise or genetic-wise that you would say, hey, you need to reach out to your cardiologist? You need to find a local integrative practitioner, someone who deals more with alternative functional medicines to find these chelation therapies? Or what should a patient do to basically get access to this?
I will tell you, to all the patients out there, do not stop seeing your doctor, but ask the doctor if he knows about chelation. Ask the doctor if he knows about the benefit of vitamins and minerals infusion, for example, of activated oxygen, which is also known as ozone, of ultraviolet light therapy or blood radiation. There are so many things out there that many doctors are not aware because they are not scientifically driven to look for that. So when a patient goes to a doctor, a formal doctor says, doctor, I would like to know if I could use a vitamin infusion, for example. And he said, no, you don't need to do that. Just the patient has the right to say, like, do you have any randomized study? Do you have any study that contradicts that, or that says that that's good or that's bad? They will not tell you because many doctors don't know that. So it is up to the patient to look for this type of healthcare practitioner into their assessment. There are many old-fashioned doctors like me, let's say. If you are not doing what I'm doing, you're going to stay behind in our formal practice of medicine, right? But now there are many doctors in these, let's call it osteopathic, let's call it regeneration of medicine, let's call natural medicine, educated, meaning that they went to a medical school, that they have the education, that they have their credentials, so that There are many doctors that graduate in the University of YouTube. Okay, we have more than 300,000 herbal formula. You're going to tell me that in 1 month and a half, you're going to become an expert? No. So you need somebody that is scientifically educated and he's been there for many times looking, to help you and me, our body organ system. So it's up to the patient, sad to say, to go, because preventive wise, doctors are not looking for that, because that's not the standard of care. We would love to, and some of the times doctors have their hands sealed. There's not much they could reach.
I think the biggest mystery around all of this to me in my research is there doesn't seem to be a ton of prevention. It seems to be that you have the cardiac event, you have the heart attack, you end up in the ER, and then the journey begins on how to heal.
Well said. Well said.
And that is where I'm kind of struggling to say, how do we prevent this? Who should go and seek out these therapies? How do they even know? Because a lot of times it's silent until it's not. And then you need to resonate with these symptoms that are landing you in the emergency room.
Well, remember this. Let me just make a simple parenthesis. Nutritionist. Everybody understands nutritionist, diet. But do you know that that's a biochemistry specialist? So when you go to study nutrition in college or at the university, you're talking about 3-4 years in biochemistry. So when you come out, take a carrot because you cannot see during nighttime. Oh, I may be thinking of night blindness. Maybe you have a deficiency in vitamin A, which is also known as retinol. Oh, you have anemia. Maybe you have a deficiency in vitamin B, or in iron. Mm-hmm. You have a problem with muscle contraction, with nerve impulse. Well, you have a problem maybe with calcium. But normally doctors are not focused into that. So it is kind of hard to say that we're not looking, that standard doctors not looking into that, but it's the reality. Yeah. And it is sad to say. So going into a nutritionist, going to a doctor that has these type of advanced studies besides medical school is the way to go. And always ask doctors. Every doctor that came into this profession came because they want to save life. Doctors don't want to kill patients. Doctors don't want to do bad things. No, that you may have some people doing bad stuff. That's nature, but that's not the purpose.
So what I hear you saying is that doctors' intentions are pure, right? Doctors want to help people. There's not always the tools, the preventative measures or the preventative assessments. And also simultaneously, I hear you saying that the patient has to advocate for themselves and they have to start asking specific questions, especially if there is an assumed heart condition that could be underlying.
Yes. And that's why they call it the silent killer. He makes no sign.
Moving on to kind of hope. Do you deal a lot more with patients who have already had the heart attack and then we look at future prevention, or do you deal a lot with how do we prevent the heart attack from ever happening?
Both. As soon as I have one of my patients, the first thing that I will do is do a study first, an evaluation on micro and macronutrients in their body, toxins in their body, and that will dictate the guidance, because we already have a lot of studies, a lot of literature from Italy, from Spain, from China, from the UK, that all these things that we do as an approach, as an integrative medicine, as a support medicine, it is good.
Let's say there's a patient out there who experienced a heart attack.
Yes.
Had the symptoms, went to the emergency room, survived, and now we're looking at healing and reversing the heart damage. They leave the hospital on an antiplatelet medication, and then they find you. What is your route from that point? So we know that there's still a blockage potentially. We know that lifestyle has yet to change, and we know that there's a potential chance it will reoccur, and they come to you for a second opinion. Where do you start?
it doesn't necessarily have to be for a second opinion, but for a supportive medicine, meaning whatever you're doing, on top of that, we're going to do this.
I love that. We talk a lot around integration and integrative health. And so really that is the perfect model, right? You're right. Yes. It's not like an opinion. It's walking alongside other experts.
And we work with a lot of oncologists, with internal medicine doctors. I have a lot of nurse practitioners. I have a well-based doctors that really are sending their patient to supportive or integrative medicine as we do. So you have a patient that already passed through a myocardial infarct, to a heart attack. All right. Yes, there are things that we could do because listen, chemistry, medicine, the pill that we give you is a chemical. Okay. The body doesn't really have the enzymes to break it down. That's right. It has many side effects. When we get herbal or natural things, they still are chemicals, but they natural. Your body have easy way for breaking it down. So what I'm trying to say is that regardless if it's a cancer patient, if it's a heart attack patient, everything happens because we have a lack of oxygen. If we have a lack of oxygen, we have a pH that is acidic, no good. Everyone that is sick has a pH that is acid. So by returning that into alkaline or neutral through oxygenation, the simple process of pure oxygenation is the key.
Interesting. So what does that look like? We have this patient who has survived a heart attack. They walk alongside a few different doctors. And for patients listening, for anyone listening, sometimes there's shame or just a desire to be loyal to one doctor. And I just want to really point this out. It's important that you have a team of people working together. So don't ever be afraid to seek out another opinion and walk with 2 physicians, 3 physicians.
Yes.
Just like we're saying, but they come out of the hospital, they come out on an antiplatelet medication and they assume that's a lifelong prescription. That's how they will prevent heart attack number 2. And you're saying, no, we need to introduce oxygen to your system. What does that look like?
Definitely. Why? Because first of all, they will be in 7 medications. That antiplatelet, is one of them, I'm not going to mention no names because we don't want to create, unnecessary problems. All right. But the minimum medication that they will take will be for 1 year. We have proof that taking medication, that doesn't mean you're not going to get again a heart attack. And other side effects like clotting, like bleeding, you understand, like microclots. So having a support medicine in which you will administer, let's say activated oxygen, also, in combination with UV light, because it will activate more the biochemical reaction of the addition of the extra molecule of oxygen to our body system that will be diffused fast because the body will absorb and it will diffuse fast, and it will do the job right there. It's not that tomorrow, no, right there. The patient will feel good right there. Way better.
Let's step back because a lot of our listeners may not be familiar with ozone combined with UV light. And so we're talking about ultraviolet blood irradiation combined with ozone. Is that a therapy that they go in and get once? Is that a therapy that is a lifelong therapy? What does that look like for your patients?
Well, once we do the investigative analysis of everything, never one therapy is enough. Like, for example, you take vitamin C, and like you, I see your beautiful skin, glossy, your collagen must be having fun, but you need vitamin C, ascorbic acid for that. So if you don't have the ascorbic acid to a level that you need, like, for example, you take a pill, 50% of that pill in your gastrointestinal tract is going to be lost. When you put it through infusion, 92% will be absorbed. So you need to have that. I don't know if I'm able to show a book that patients could look for.
Yep, we can link it in our show notes as well.
Yes, yeah, this book is very good by Tom Lowe. Okay, he talks very good and he gives good information about ultraviolet irradiation It's beautiful. You could buy it in Amazon. I have no conflict of interest. I don't sell it. I don't make money out of it. This is educational purposes.
So
Okay.
for those of you listening, not watching, the book is called Invisible Cure.
Yes.
It's called Fix Your Immune System, Fix Your Body, and it's the definitive guide to UBI, which is the ultraviolet blood irradiation that we were talking about that Dr. Hoa combines with oxygen. So
Yes.
that book you said is available on Amazon, and we can link that as well in our show notes.
Yeah, you can look that, but I want to make clear, I don't make money out of that. This is for educational purposes. My sister, that is a dentist, an odontologist too, and does surgery. She uses ozone, she uses UV light. I mean, there are a lot of things that we could put on hand of people that you don't have to really learn a lot of biochemistry to understand the good outcome that is coming.
For the listeners who aren't familiar with UBI, I think this is something that we're trying to help people understand when we're looking at these therapies that might be new to them. What is a treatment? So they come to you, you look at you do a urine analysis and then a comparative one. So we start looking at what chelation might be doing. And then we say, we're going to add on a UBI therapy. Is that, I assume, some sort of an IV infusion therapy? Is that hard for patients to access? Is that simple? Explain what that is.
The National Certification Medical Association, the American College of Advanced Medicine, they have like credentials, or they have like training for doctors and nurse practitioners and let's say natural doctors, let's say, to go into training and learn about this. Yes, not every office in New York, in America, not every office in America has this. Europe is totally different. Doctors graduate with double degree, medicine, and this is what we're talking about. So you find ozone therapy, you find chelation, you find hydrogen peroxide, you find superimmune nutrition, you find everything in Europe. Okay, exactly, specifically Germany, easily. All right. So there are a lot of stuff. We are kind of behind. Like chelation has been on existence since 1956, 58. And it's only been one trial that actually demonstrated how good it is in reperfusion, in blood for diabetic and non-diabetic. Once again, it's called TAC trial. You could look at it. Okay.
ACT trial.
Yes, T as in Tom, ACT trial. Yes. Again, it's trial to assess chelation therapy. They are evaluating if indeed that works or not. And it does. So a patient comes to my center after I do blood work, EKG, medical history. You need, doctors that are listening to this, you need a good clinical history. All right. Remember, either the old CAR or the OPQRS. That's for doctors. So when you're doing your evaluation, okay, in the event that something comes through legal wise, you protect it. Okay, because there is nothing bad happening through blood irradiation and oxygen, ozone irradiation, ozone blood therapy. No, the indications that are kind of wrong is through gas, and we don't inhale that to therapy. So we're not talking about the gas one. We're talking about the one that you come in. I will take a specific amount of blood through an IV, and then I'm going to pass it through a solution, and then you are going to oxygenate to get that ozone to a specific flow rate calibration with a specific oxygen tank, industrial medical, so that when you put it in through the blood, it attaches to the hemoglobin, and the blood will change. It will come like red bright right away. You put it again into the patient's body, and the patient is going to feel like, oh my God, with such a much energy and good right there. It is amazing. At the same time, it passes through the UV light system, set of ultraviolet B light, not just UV light, because we have different type of UV lights, that ultraviolet light that cause damage. We're talking about B light. That's another topic, and that's more deep. But it will pass through that little machine, let's say, that will irradiate the blood, and it will actually eliminate viruses, fungus, microorganisms, bacteria. It goes inside the body like kind of a dialysis, like filter, like clean, and then your blood is like Hulk, and rich, good.
Yeah, I often hear about that UBI therapy being an immune modulator, right? And so we were really looking at that balancing effect. And
Yes,
I believe in that book you referenced, there's a whole chapter on heart.
yes.
True?
On
Okay.
many things, not only heart, on many things. Immune system. To all of you guys there, the center of your immune system is your gastrointestinal flora. If your gastrointestinal flora, bacteria, we have 25 trillion bacteria there. If we don't have the amount of bacteria, good bacteria that you need, you have a problem. So good probiotics, prebiotics, a specifically good one, not anyone. Okay, that I'm not going to mention anything here because I'm not selling. Okay, but good probiotics will reestablish your flora. You don't want to use antibiotic. Antibiotic kills good and bad bacteria. So if I'm using Ubilite, that normally, so that you know, in surgical rooms, Ubilite is used to sterilize, to kill bacteria. You understand? And we use ozone to kill the odor, to kill bad things in the environment. So by using the right technique and the right scientific approach, you could have a very positive outcome in our health, in our body health. So having to reestablish your flora is not that easy. It takes almost 2 years for you to reestablish your normal flora after you take an antibiotic. So by using UV light, you destructing all these bad things that are there. You're helping the immune system, and you're not causing no damage. Tell me, what is wrong about that?
It's beautiful. It's beautiful. And we call this podcast Don't Take the Pill for a reason, not to say, hey, drop 8 prescriptions that you're on today. There's a process and there is someone you need to walk beside to walk you through what that looks like. However, exploring these therapies that have been studied for years, and I'm talking near a century, is something that is worth patients knocking on their doctor's door and saying, have you considered this therapy for my condition? Have you considered treating my heart condition with UBI and ozone? Yeah, I want every listener to start advocating for themselves and asking their doctors good questions. And if there is a place where the doctor shuts the door, then don't be afraid to email us at info@don'ttakethepill.com and say, we need a practitioner in our neighborhood. Can you send me a list? We need someone like Dr. Hoa, who has this desire to continually learn and find the root cause to make sure that I don't have a reoccurring heart attack, right? I want to do everything I can to not end up back in the emergency room. I find we could talk about this for hours because there is so much detail when it comes to the beauty of the heart. I also want to hear maybe 1 or 2 awesome success stories of patients that had a pretty dismal outlook on life, in that you've been able to introduce these therapies to, and they, right, just like you, once you open the door to natural ways, maybe they don't look back and they live a life of health.
First, I want to say to all of you there, listeners, the audience, you have a chest pain, don't go and take a vitamin C. You need to go to the doctor. You need to go to the hospital. So let's get one thing right. Our medicine in the hospital, the approach will help you right there to establish you, to keep you, let's say, within normal limits. Is the support you need to do after or even before. So I'm not saying that the regular medicine that we use is not working. No. It does work, but we need to use preventive approach before and after. Now with this pandemic, that the amount of fatigue, the headache, the pain, the libido, the loss of hair, the mental frog, within the first 2 3 therapies of ozone combined with UV light and my protocol that I get from LCC is an alliance of doctors followed by Dr. Paul Merrick, an ICU doctor professor that guide us into how we could use vitamins, minerals to help into these disasters of pandemic that we are suffering right now. So the combination of both things, within 2 3 therapies, the patient comes like, oh my God, that's it. And they continue coming. I have to tell them, no, you don't need to be coming. I see you once a month or once every 2 months. you know, because they feel very good. But you also need to understand that these vitamins, minerals, and medications compound they use have to come from a really FDA source compound pharmacy. Because, for example, vitamin C, for example, ascorbic acid, it could be extracted from so many sources. It doesn't mean that that's good enough for you, for what you have. You understand? So it's good if you go to a doctor and anyone that is really credentialed, certified into this, and give you the right therapy. What could I tell you about success stories? Like doctors, I have doctors that they told me that they don't believe in this. They used to tell me, I don't believe in that. And I said, yeah, but in this pandemic, being diabetic, having coronary issues, cardiovascular problems, and having completely having their way of life completely changed because they have no energy. They feel with pain. They feel with they don't feel they have their leg inflamed with edema. And by just doing this type of therapy, within the first one to the third one, they like brand new. I cannot give your name. HIPAA is not, confidentiality, but there is not a single practitioner that is doing this that don't have tons of positive outcome, not negative. There is not a single negative outcome. None.
All right, guys, you hear that? Hear that there is tons of positive outcomes from a cascade of doctors, and it's worth going to and asking your physician, what about this therapy? What about UBI, ozone therapy? What about chelation therapy? What about vitamin C? Let's dig a little deeper. Let's get to the root of my issue. I'm worried that I'll have a cardiovascular issue in the future, or I've already had an event. Let's look at what healing can bring for my life. Dr. Hoa, we appreciate you being here so much. And like I said, we could spend hours talking about this, but let's close it up with 3 things somebody can implement in their life today for better health in general. What 3 things of wisdom would you pass on to our listeners?
Okay, first, understand that politics and science results in politics science. Science and science results in science. So you want to follow the science. Don't follow politics. That is the reason why insurance do not cover vitamins, minerals, and all this stuff, and all these procedures that save life. That's first of all. So I will go back, get your immune system strong by using probiotics, prebiotics. Always get good vitamins infusions. Okay. Try to get organic nutrients. I know it's difficult to get organic nutrients. Why? Because when you go to the supermarket, even those ones that are labeled as organic, it's not indeed organic. Look at every product has something that is called PUL number, pool number. It has like 5 digits. If it starts with the number 9, you got a good organic product. If it start with the number 8, you have a genetically modified organic product. And if you start with 4 and number 5, is what everybody uses every day. You could buy the fruits, you see those little labels on it. If you start with the number 4, number 5, that was growth. It was harvest with pesticide, insecticide, hormone, all this stuff. Pure organic. Start in that label with the number 9. That's how you know you're getting organic compounds, organic material, organic nutrients. That's what there is a lot of stuff to say, a lot, colonics, it is a lot of stuff. Right now, our environment is so toxicated with so many toxins that regardless wherever you go, you are exposed to them. And your first line of defense is your skin. But you need to treat your skin, your liver, detox your liver, detox your gastrointestinal tract. But how you get it, you have to go to good and specific trainee or healthcare professional for that.
We appreciate your wisdom. That is a list that I have not even thought about. So I was taking notes, writing down number 9, number 8, number 4 and 5. We so appreciate you, Dr. Hoa, and we look forward to just an ongoing relationship and maybe getting you back on in the future. Thank you so much for your time.
I'm happy and I'm here for you guys.
That's awesome. Thank you for your time. We will speak to you soon.
You're welcome. Have a good day and enjoy.